Senator Harkin has been an unwavering advocate for prevention. In my 10 years in the House working on prevention, I followed carefully his tireless efforts over here in the Senate, and I think the prevention community is very, very lucky to have him as a champion. You know, what we have to do here is take very important prevention steps in this piece of legislation, and I think we're about to do that. Our current system is clearly broken and unsustainable. We really have, as Senator Harkin, this is echoing what he said, a disease management system as opposed to a health care system, or we have a sick care system versus a health care system. 75% of our health care dollars are spent on a few chronic diseases like cancer, diabetes, heart disease, stroke, and a few others. Prevention is really the key. We must get out in front of these diseases. When I talk about disease management, what we're talking about is trying to get out in front of the diseases. And to give you one short example on the disease of diabetes, I went to one of my wellness centers in New Mexico on a tribal reservation and met a young person. She was little over 30 years old. And she told me that she'd been diagnosed as pre-diabetic. Her blood levels were too high. And she decided she was going to change things. And so she was going to this wellness center. She got advice on her diet and changed her diet, 6 weeks of exercise. And she reported to me that after that, she had brought her blood levels down. She had normal blood levels. That is exactly what we're trying to achieve with prevention, healthy, productive persons who are out there in society. And the wonderful thing about all of this, as Senator Harkin has emphasized here, is it saves money. It saves money, dramatically saves money. For every dollar invested, many more dollars are saved. One of the things that is, and I just came from a tribal meeting where we were visiting. It's a wonderful thing President Obama has done, invite all of the nation's tribes here for a large conference, a large gathering, to hear from them. And I think one of the things he's going to hear is that our health care problems should be front and center and should be a part of this bill. And what many of us are advocating for, and I believe they have done it in the House, is the reauthorization of the Indian Health Care Service Act, which would be a big step forward. It has a lot of the prevention measures in it, Senator Harkin. It moves us forward. It's been a long time since we've had that reauthorization. I think it's been a good 10 years. The Bush administration never made it a big priority. And we were unable to get it done. But I think it's going to be a part of this overall bill. At least that's what I'm pushing for, and I think that would make a huge, huge difference in Indian country. I mean, the single issue with my tribes and then in the tribes I've been visiting with across the nation, if you say what is the one issue, it's this reauthorization and then put the resources behind the Indian Health Service so that it can truly function, and a part of that is pushing these prevention measures. I mean, in my state of New Mexico, tribes are at, unfortunately, way out there in terms of the numbers, and we're in the middle of an epidemic on the Indian reservations in New Mexico. The same thing's true in the Hispanic community in New Mexico. So we're seeing a disparities on these healthcare issues with our minority communities, which is very disturbing.